Next order of business is the roll call of members. Please indicate your presence when the machine is open. If all the members voted, tally the roll.
I'm Earl Harris. Welcome to another, what we hope is an exciting and informational edition of Sessions. I'm joined again by my podcast partner here, Representative Blake Johnson. We're going to talk today about one of the hot topics for 2025 that literally affects everyone. We are going to focus on healthcare, whether you're in good health now, whether you have people you're taking care of, whether you will need to be taken care of, whether you have health issues. This is an edition that is going to have an impact on you. We're working in the legislature on ways to make things better for the citizens of the state of Indiana. And we are joined today by one of those leaders in the State House. And we're going to talk to her about what's going on and some different ideas and thoughts we have on improving this. We are joined today by Representative Robin Shackleford. She is out of Indianapolis. She serves as the ranking minority member on the Public Health Committee, and she's going to share a lot of good information with us. Robin, thanks for joining us.
Thank you. I'm excited to be here. And I just want to tell everybody, just come on in. We're going to just hit all those highs about healthcare.
First-time guest, too.
First-time guest.
Everything you wanted to know.
So let's start off on, I mentioned that you're the ranking minority member of Public Health.
Yes.
What is the focus of that committee? Let's start there first.
So the focus is what it basically says, public health. Anything that deals with health, whether it's a hospital, a physician, drugs, the whole scope of when you're talking about healthcare is all looked at in that committee.
Robin, so as it relates to this, we were talking before we came on the show here, and even just our own personal stories dealing with the healthcare system. It is hard. It is hard to go into the healthcare system. It is hard to understand the payment processes afterwards. It's hard to understand all the details and minutiae that kind of make up this enormous piece of human society. And I think for a lot of Hoosier families, they probably hear us say, okay, we're working on healthcare again in the legislature, and they go, it's just too big. There's just too many issues. It's too hard to work through. There's no chance. Why should we have hope that a group like the legislature can actually make a difference in this issue area?
So I would say one of the things is this is one of the most nonpartisan committees. This is one of those committees that everybody know we are trying to help the whole state. We know that there are issues when it comes to the processes, when it comes to the care, when it comes to the pay of healthcare. But we are in it to make sure we try to unravel and solve some of this. So I don't want people to give up hope, because we're there making sure that there is going to continue to be hope, and we're there to make sure that the work gets done, but do it in a way that we can all work together.
So let's just dive in here a little bit more, as Blake has already started us. Big issues. What are the big issues on the table for this session?
Some of the big issues is, one, reducing the cost of healthcare. That is one of the main things that everyone has been working on. Everybody wants to know, why are my drugs so high? Why does it cost so much to go to a hospital? Why does it cost so much to see a specialist? So we are still driving down, trying to figure out where those costs lie, and then where can we step in to try to fix some of those costs, whether it's with the hospital, holding the hospitals accountable and responsible, being transparent about what you're charging, being able to look and see what everybody else is charging. That is one of the things that we passed with our all payers claim database, that now we can look at the claims and see, okay, why did a colonoscopy cost $7,000 at this hospital, and you can get it for $2,500 over at this facility? So that transparency, some of those things that we've been making leeway in, is now going to start giving people the opportunity to shop around. And so now we're working on that when you start to shop around, if you find something cheaper, hey, if I want to go over here and get my colonoscopy for $2,500, then I want it to count against my deductible.
Yeah.
Because then why would I still pay higher prices? So that whole cost and transparency, that's always at the top of it. And then next, we're looking at Medicaid. When you talk about that $1 billion loss, if you're going to call it a loss, if whatever you want to call it.
Shortfall, whatever.
Shortfall.
It's all bad.
We missed the mark.
Yeah.
The oops.
Yeah.
The
$1 billion
big
oops.
$1 billion oops. So now everybody is trying to figure out, okay, where can we cut costs in Medicaid? How can we improve the process with Medicaid? And we want to make sure that we're not cutting back on Medicaid services, even though at the same time we're trying to reduce that cost. So those are some of those big drivers.
I want to start a little bit more about the first one. You know, you find it interesting because when you go shop for something, if I go buy a car or whatever,
Suit
clothing,
vest.
suit, what?
A suit vest.
A suit vest, yes. You like it. Don't be jealous. Whatever it is.
Earl's keeping them in. He's keeping them in.
That's right.
You know what the cost is. But when you go for medical things, you're waiting until you get a bill. And I think, you know, you brought up something that's interesting is you can see, as you said, a colonoscopy, it costs this much here and this much here. Why not make medicine that same way where you can see, and hopefully that'll help drive down cost if I know that my competition is doing it for less.
Yeah, and so I know one of Governor Braun's initiatives have been the transparency. So he does want to work on it. He sees it as an employer. He sees the cost of healthcare going up.
Yeah.
So I think everybody is in the same page of how can we identify where those costs are? Why are there differences? How can we come together and be like, okay, we want to see who owns the companies, who owns the hospitals. Where is the cost going up at? Where is the driver? Is it really the pharmacy benefit managers? Is it the middleman, or is it the manufacturer? Or is it the wholesaler? Or is it once it gets to the retail pharmacy? So just looking at all those, even with those drugs, and looking at that whole system of how everything is put together.
And we know that one medical issue can put a family into financial harm for the. That's it. You're financially done. So it's good to have some sort of protections that we're looking at putting in place.
I was going to ask you this is a little bit of a detour, but you know, we're in a state where medical devices, pharmaceutical companies, like we're kind of at the epicenter of the industry in a lot of ways, IU Health being an enormous healthcare system. Do you see from your role that kind of our place in the ecosystem, do we have an opportunity to be the leaders in all of this, or are we catching up? You know what I mean? Like, is that kind of in terms of healthcare policy and getting things better?
We're catching up, because when you look at the healthcare in Indiana, we're either at the top or the bottom of every list, whether it has to do with chronic illnesses, heart disease, smoking, obesity. We haven't invested enough in our healthcare system. Now we're investing enough in universities and facilities and for them building buildings, but when it comes to the actual health of our state, we are lagging way behind. And so that's why it's so important when our former governor put together that whole commission to start looking at how do we start investing now in our healthcare? How do we start actually putting millions that we should have been putting in? We're going to be looking at that this session of trying to get that money back into our local health departments. We just had a great presentation from the State Department of Health so far from the first year, what they've been able to do with that money, how many pregnant women were able to get screened, help with maternal health, how many people that were able to get help with tobacco cessation, all these things, how many partnerships the local health departments were actually able to build within the community, and now everyone is working on trying to make Indiana a healthier state. We got to continue to do that. We got to continue to do that investment because, like you said, or maybe didn't say, we're the leader in so many other things, but when it comes to healthcare, we're lagging way far behind.
And what you're focusing on, what you just talked about, is really prevention funding.
Yes.
How do we stop stuff from getting bad? Because once it's bad, obviously for your health it's bad, but it's also bad for your pocketbook.
Correct. We got to get in front of the spending and start spending more on the preventive side. So that means spending more on the drugs to help people with their obesity, making sure those drugs are covered by Medicaid. What we're doing now is we're covering bariatric surgery and bariatric surgery only. So by the time you get obese and you don't want to have a child or a teenager go underneath a knife and they haven't tried this piece yet. When me and Dr. Barrett had our whole stakeholders meeting on diversity, on obesity, I'm getting my press conferences mixed up with diversity. We just had a
busy
one
day.
today.
Yeah, it's a busy day.
Busy day today with the whole DEI issue. But him and I had a stakeholders meeting back in October trying to get legislative recommendations on how do we actually start putting a dent in chronic obesity. And we had so many healthcare providers there that were in tears, that work with kids, that work with teenagers. So one provider was there from bariatric surgery. She said the youngest child that has had bariatric surgery is 4. And she was in tears talking about the bariatric surgery. Currently in Indiana, there are teenagers that are on the waiting list. They're waiting for their Medicaid to come through and get it approved. But before you get to that surgery step, we would love for them to get education on what to eat, how to exercise, get some medication to help them. We're going over here to the extreme, which is more costly, and we need to take a step back and take them back to this treatment first.
You hit where I was going to go next so there's a couple of things I think there. As you said, education on food and what's healthy and what's not. You can't have 2 donuts every meal. You have to have some vegetables. Stop it, Blake. You have to have some vegetables. Okay, I know you have 3.
Yeah.
You have to have some healthy food in there. And part of the problem is, I know this from some of the work we've done with urban farming where I am in Northwest Indiana, is there's a Faith Farms in Gary. They had to teach people in the neighborhood how to cook with vegetables because they didn't know. So that's part of it. And the other thing I want to dive a little bit more into is, we have a lot of the injections and things that will help with weight loss. We obviously have Lily, who has something here in Indiana. What's been the reception or what's the temperature on having those things covered by insurance so that people can have easier access to them on the financial side?
So that's where we're headed towards a lot of legislation, including myself, is I'm trying to get those medications covered under Medicaid. Because we've seen that on average, a patient can lose 15 to 20% of their weight in a timely manner over some months. Okay, Earl, well, every time I have this conversation, I see the men like, pull my belt. I'm not talking about you, but it has
She's not talking about me right now.
It has great success. We have seen success in these medications for the amount of money that they cost and the success that we're looking at. And that success bleeds into reducing type 2 diabetes. So that is one of our biggest cost drivers. That is when I sit down, so you guys may or may not know, I'm an insurance broker. So as soon as someone tells me they have diabetes, I already know their insurance rates are going to be way higher, whether it's life insurance or health insurance, because it is so costly to be diabetic. And it leads into so many other illnesses. So not only looking at the medications, but our State Department of Health has a great program called Food as Medicine. So you now have doctors prescribing healthy food to help combat obesity, and it's called Products Are Us. So you'll see that I have a bill to help give more money, because right now we're only doing it with 11 organizations across the state, or kind of in a pilot. But they've had great success, and we want to expand that because we want to look at the healthy food. How do you prescribe the healthy food? And then we'll continue to look at healthy food access to make sure that urban and rural areas have access to those fruits and vegetables and healthy food.
Wow. There's a lot going on that I think people unfortunately don't know that there are helps there, and hopefully we can get some information out about it. So let's jump into some other things. I know we had some conversation before we started recording, and you talked about some work that's being done in terms of cancer.
Yes. So I will say this is going to be one of those great sessions for cancer. We just passed a bill yesterday from Representative King where she requested $7.5 million to go towards breast cancer research. This will be great. I don't know if the $7.5 million is actually going to make it. We passed it out of Health Committee, so it's going to have to go to Ways and Means. But currently, our state does not put any funding into cancer research, into breast cancer research. So there are a number of states that already do put money into cancer research, whether it's breast cancer or not. So our 2 universities, our 2 certified cancer research, IU and Purdue, receives no funding from the state, whereas other states do. So this is why this is so imperative. When we start talking about making that investment, this will be the first time that we actually start putting money into cancer research. So that will be a great bill, and we'll see how that goes throughout the session. The other one that I'm carrying is trying to get more diverse people, whether it's in the urban areas, whether it's in the rural areas, if you're in those underserved areas, to be able to participate in cancer trials. We know that the medication acts differently in different people, whether it's their race, their body weight, where they're raised, but a lot of the companies need to be able to have that diverse mix in there so they can see how the drug, how it actually works with cancer. We have seen that a lot of cancer trials can't be successful. They have to end because they can't get people to participate. And one of the barriers is the cost, because on average, if you're in one of these trials, it costs about $600 to $700 a month, $600 to $900 a month, because you have to pay for your own lodging, you have to pay for your own travel, your own food, if your family is coming, all that the participant has to pay for. So this bill will allow those organizations to actually set up a plan, a program where they can pay for participants and pay for those costs.
How are you feeling about maternal mortality rates, right? So in the last couple of years, we've obviously taken steps as a state under the majority that have stepped back, right, in terms of maternal health, access to safe and affordable abortion care. How are you feeling about our efforts in that area?
So I would probably rate us a D-.
Okay. They don't go much lower than that.
Yeah.
It could be an F, but I'm going to give them the D- for effort. We had a maternal mortality study, I believe, last summer, either last summer or before last summer. And Dr. Box came and presented, and she even said that even with the efforts that they were doing, our numbers were still going up, whether if the mom was white or whether if she was a minority mom. So what we were doing was not working. So we needed to actually address specific things, especially when it comes to Black moms, because our number is so way much higher than here with a Caucasian mom. But specific things had to be done. We got recommendations. And so that following year, we implemented none of the recommendations. We actually got into a little debate, myself and the chair, because when it came to finalizing the report, he didn't want to put any of the recommendations even in the report. And so that's where we are. It's very contentious. We haven't passed, and I can't say that there has not been effort put forth between like the Republican women and the Democrat women in legislation. Representative Summers formed our whole maternal caucus, but none of that legislation has got a hearing and nothing has been passed. So our numbers continue to be bleak. Now, what has helped, and the reason why they're getting a D-, is because the money that we put into that preventative that the governor helped assist, that has reduced our numbers a little bit in those cities that used it on maternal health. So the report we just got yesterday, I purposely looked up Marion County, and our numbers went down like about 1%. So we see that if we put the money in the right area with the right groups, we can get those numbers start coming down. Yeah.
You know, you talk about maternal health, you're talking about moms, pregnancy. Last time I checked, if mothers don't make it through pregnancy, it's harder for us to actually exist as a people. So we really should be putting some attention to that. And you brought up something else, it doesn't matter if you're white, Black, Latino, Asian, Republican, Democrat, it's an issue. It may be, as you said, a little higher numbers for Black women, but it's an issue all across the board.
Well, to that point too, I said this on a panel recently. We tout being a great state to raise a family, and I will give them that. Like, my family obviously felt that way. Your family's obviously felt that way. Yeah. But we are not a great state to start a family. We are not a safe state to start a family, and that has got to be something that we take very, very seriously.
Yes.
Yeah, we need to pay more attention to that. So I'm going to talk about something that I want to go, next area I want to cover is something that I had, was part of my life for a little while in terms of my mom, and that is home care. Now, I know, I already see the look on your face, and we've had some conversation about that. Yeah. Give us some information.
And my dad.
And your dad, you went through it also. You went through it too. Yeah. Talk to us about home care and how that is working in Indiana right now and what we need to do to make it better.
So Indiana decided that, first of all, we wanted to privatize our Medicaid piece when it came to seniors. We now have the program Pathway to Aging. So that means that now our Medicaid program is ran by insurance companies. Those 3 insurance companies are Anthem, United Healthcare, and Humana. With that in mind, they wanted seniors to be able to stay at home more. But we did not build out our home system so a lot of these seniors can stay at home. When we started this program and went down this avenue, we didn't have a lot of home health providers. They're not certified. They're not trained. So now you have these seniors that staying at home and they're contracting with these home health care companies. A lot of them just popped up, just came into business last year. So as I'm out talking to seniors, whether if I saw it in my own father and helping him last year towards the end of his life, or helping my aunts as I'm at their homes and seeing home caretakers come in, the non-certification, the non-training, they don't know how to properly cook. They don't know how to properly clean. They're not asking what is the patient currently on. Like my aunt is diabetic. You have a caretaker that comes there, didn't even know she was diabetic, making her meals that high sugar content that a diabetic should not be doing. They're bringing their kids to work. One woman drove up, had her kids in the car, and went in and thought she was just going to care for a little bit and then got back in the car with her kids. Or the kids are coming in. They're changing mid-shift, or someone will come to a senior's door and they have no clue who's supposed to arrive. The person that was supposed to arrive, now it's a different person because they had to get a cousin step in and come in, and they're using it almost like babysitting. And so the system, it was never structured in the first place. So we have to go back. I do have a bill. I know Representative Harris is very interested, and I actually took the bill from O'Brien because he couldn't get a hearing on it last year, trying to build some type of certification or training with home health care aides, because right now it's just a wild, wild west out there.
You know, and it's scary. And I have to say I was fortunate in that I know the owner. I'm friends with the owner of a company. Mm-hmm. So I knew my mom was going to be taken care of efficiently. But it's scary to think if you don't have, in the position that I was in, you're not in that. Like you said, it's the wild, wild west, and you have some random person showing up. Mm-hmm. What do you do? I mean, what options does a person have? And they're limited.
And they're treating them all kinds of ways. They're not getting them to their appointments on time. They're bad-mouthing them. And you got to realize you have a senior that's here by themselves, and then the stranger is coming in to take care of them. Maybe a stranger, maybe someone they've seen before. So they're totally dependent on that person coming in. If they don't have a spouse there, like one of my aunts and uncles, so I hear everything that's going on because he's there when the home health care person come. But the system is supposed to be set up to help give him a reprieve, that he should be able to go get him something to eat. But he does not trust them so much that he still has to stay there. And so the system is definitely broke, and we got to get that fixed.
Wow. And hopefully legislatively we can do some things with that.
Yes.
When you look at problems, and you talked about you're obviously a legislator, and then you work on the insurance side. Someone watching this, someone listening, that sounds like a situation I have, or it's something connected to. What is the best suggestion you have for people who are having issues related to either their own health care or their loved one?
So I would say if you're having issues, say with a hospital, with a doctor's office, reach out to the State Department of Health. Don't be afraid to call the state. Don't be afraid to look up the number, or call us. We can get you in contact with the right number.
We do constituent services.
Yes. If you're having issues with a nursing home, the State Department of Health regulates and goes out at those nursing homes. So call the State Department, because you don't want to just file your complaints with the facility or with the doctor. You want to take it to the state level so we can then look into it. If it is an issue with your Medicaid, any things that deal with FSSA, Division of Aging, then that goes to FSSA. So anything that needs to pay for your services, or you're not getting treated right because you think since you're a Medicaid recipient, that is going to go to FSSA. But at the end of the day, you can always contact us. Yeah. You can always contact, we have staff, and then we will take on that issue and get it to the right place for you.
You know, I think sometimes people forget, yes, we're lawmakers, yes, we make legislation, we vote on it, but we do take care of constituents like that and do receive those kind of calls. Yeah. So it's good to know.
And especially if it has to do with the state and a state agency, because that's the stuff that we want. Now, the stuff that we get tired of getting is the snow removal, the potholes, the stuff that the
sidewalk
city,
issue.
The stuff that the city is supposed to take care of. But the stuff, if it regards to health care, that's at the state level. And we would love to work with people and help them with that.
Okay. We're coming down. We're almost done with the show here. So before we wrap up, let's talk about on the career side, because I know one of the issues we have is we have a shortage of, and I know that's a long list too. Yeah. Talk to us about that, and what are some things that are going on to help that?
So, well, you may want to talk about your bills. We do have a shortage of doctors. We have a shortage of specialists, especially when you're talking about OGBYNs. There is a shortage in rural areas in particular, because you may be in a rural county that you have to go 2 counties over. just to have a meeting with a specialist. And when you're sitting there meeting with people and looking up a doctor that's in their area, then if you're meeting with somebody, you may have to go out 25 miles, 50 miles, 100 miles. And that's because we don't have a lot of healthcare professionals. So we got to do something. A lot of time the barrier is cost. A lot of time the barrier is, okay, do I want to stay in Indiana? How do I stay in Indiana once I get through? Is there some type of incentive? Because other states are offering incentives. It's just like the teacher shortage. So it's the same with the nurse, the doctor shortage. Like, we got to put some skin in the game. We got to start incentivizing people to, one, go into the industry, and then for two, to stay here in Indiana and work with our communities.
Yeah, and I'll really briefly, the bill I have is related to paying off of medical school loan, which people come out owing about $205,000. So it's a 10-year commitment. By the end of that 10 years, you will receive $200,000 to pay off your medical school, but that commitment of 10 years is big. It is prorated, so if for some reason you need to leave, but hopefully if you stayed 10 years in the state of Indiana, you have roots. You've gotten possibly married, you've started a family, and you're less likely to leave. So looking at drawing people and getting them to stay here.
I think that'll be great.
Yeah, and I know nurses, we were talking about the importance of nurses. There's also a nursing shortage that we need to work on as well.
Yes, and we've been there a long time. So we have a lot of people that are going into nursing, but we need way more. As our baby boomers are coming through the system and they're starting to be home more, they're getting sicker, or they're having to go to a facility, then that's why there's a need for more healthcare professionals.
And I want to point out something, because I went through, as you went through with a parent, I went through some things with a parent. Nursing is not just a female profession anymore. I think my mom probably had as many, about equal number, male versus female nurses. So that's good to know as well.
Well, it's so funny because I was sitting down with one of my clients, because a lot of people don't know if they have a nurse practitioner or they're actually seeing their doctor. And so this gentleman, this senior, since he was seeing a male, he just assumed it was a doctor. And so when I'm looking up, trying to put his name in, a lot of time the nurse practitioners aren't in our system. Yeah. So I said, are you sure he's a doctor and maybe not a nurse? And so I said, he's like, I got his card. So he gives me the card, and it specifically says nurse practitioner. And he said, we got men nurses? When do we get men nurses?
Men can do different stuff now, too.
Yeah, they can.
I was like, yes, we have men nurses, and you have one.
Yeah. Oh, I want to bring up one more thing. Sorry, Blake, I know you were looking to dive in.
You're good. Listen, I'm just learning at this point.
I learned this recently. So we're talking about the bill I have, which OBGYNs are part of it. We have issues, as we talked about, with maternal health. But I recently learned, and I knew we had, of our 92 counties, I knew that some of them did not have OBGYNs. The scary, to add to it, that I learned is half of our counties don't have OBGYNs.
Correct.
That is scary in terms of pregnancies.
Pregnancies, in return of you going to get your preventative appointments, you're going to get your gynecological visit, your pap smears. A lot of women don't get it because they don't even want to have to deal with having to travel so far. I've talked to women, they're like, oh, I got one like 5 years ago. And they're at the age that they should be getting examined every year. So you see a decrease in people getting their preventive care because they just don't want to deal with that barrier of having to travel, having to book an appointment. Usually when you book an appointment with a gynecologist, you're booking like 3 months out. They're so backed up, and that's even here in the city.
Yeah.
So when I have to book my appointment in the winter, I'm booking in the fall just to get one in the winter. And then God bless if you got to miss that appointment or change it.
Yeah.
Then they're like, oh, we can get you in like 6 months.
6 months later.
Yes. And I'm like, I'm not even going to get my annual because it keeps going out too far. But yeah, it's definitely it's such a barrier when it comes to women even trying to stay healthy, the ones that want to stay healthy, and then the ones that are getting pregnant and need to go see that gynecologist more often.
Well, as a guy with a pregnant wife and a little baby that we're still taking care of here, so the total of 2 years soon. Thanks for all your work, because it's even for us. We have resources. We know how to advocate. We know how to look out for the wrong things and all of that. It's still daunting, and so all the work that's being done by the committee and by you in particular, we're obviously grateful for.
Yep. And before we close out, any last words of advice for our viewers out there when it comes to healthcare?
I would say definitely advocate for yourself. Don't be afraid to say no. Don't be afraid to question the care that you're getting. with your doctor, don't be afraid to push back, because you have to be your own advocate. You have to speak up. If you feel deep inside of you that something's just not right, or you feel like they're not listening to you, then definitely speak up, or bring a family member with you to the next appointment so they can sit there and listen and take notes and be that advocate. But everyone is going to have to be their own advocate when it comes to the healthcare system.
I think I just maybe bring Robin to the rest of the
Yeah, I know. Robin, you busy?
She knows this stuff, so talk to Robin.
And don't make her mad.
I will be there taking notes. I'm like, wait a minute, what did you say?
Yeah, that is some, right?
You know, and I've had some other people talk about that, is because if it's, you know, like in the cases you and I talked about, it's our parents. So you're talking emotion, you're talking lots of things. Having somebody that maybe still loves you and the person, but can be a little bit less emotional, has got to help. I mean, I know I had a cousin that was there, and she was close to my mom as well, but she was there with me throughout the whole ride, so that there were two of us. And then one of her daughters is a nurse, so she showed up when she could show up.
And that's what one of my young friends, who now has passed away, she had to go get trained on how to do her dialysis. So she wanted someone there because she was going to do her dialysis in home. So she's like, Robin, can you come with me, go through the training, like sit there? Because in a state when you're thinking about it, you may not be taking all the notes and really focusing. So I was there to be her note taker and really to ask the questions, ask clarifications, like, okay, where does the machine got to be? How does the tube got to be? Because you're not, when you're going through the illness, sometimes your mind is just not always there. Your mind sometimes is focused on just getting up for the day, just sitting up, just getting through the illness. And so when you have all these appointments and when they're trying to teach you new things and all this stuff coming at you, then yes, I was there to make sure that we learned everything that she had to do so she could do her dialysis at home. Because it's a lot.
It is a lot. And healthcare is a big issue. And thank you for everything that you are doing to make Hoosiers healthier. Maybe we can look at having you back on after session and talk about some of the good things we hopefully have completed by then.
See what we got done.
See what we got done. And then yell at people if we didn't get stuff done that we needed to. This will bring to close another edition of Sessions. We hope we've given you some great information in terms of your own healthcare, your loved one's healthcare, giving you some ideas, giving you some suggestions if you run into some problems. We want to thank our guest today, Representative Robin Shackleford. She's a state rep out of Indianapolis. She is the ranking minority member of public health and will play a big role in what we do in terms of healthcare in the 2025 session. Thanks for joining us. Tune back in with us next time.